So very good morning and warm welcome to all of you. And at the outset, I would like to thank Javarsha sir for arranging this webinar. And today we will discuss something interesting and something that is useful for our day-to-day clinical practice. That means interpretation of the mental symptoms, miasmatic approach. And it is the desire of every student that their teacher give them some meaningful learning experience that will help them to fight the challenges in their life. So today I would like to give some meaningful learning experience that may be useful in our profession and in our day-to-day clinical practice. And this is our college. This is our new building. And the more the allopaths grow old, the more he is pessimistic. The more the homeopath grows, the more he is enthusiastic and optimistic. And this is very true in the case of the study of the mind and the mental rubrics. The more the allopaths grow old, the more he is pessimistic. The more the homeopaths grow, the more he is enthusiastic and optimistic. Give a man a fish, you feed him for a day. Teach a man to fish, you feed him for a lifetime. So the second one, that is what we are going to discuss. How to fish rather than giving a fish. And majority of the homeopaths think that the mental symptoms are very important for the prescription. But one of the major problems we encounter in practice is the conversion of the patient's symptoms into the language of the repertory. And in order to overcome this problem, we should understand the exact meaning of each rubric, sub-rubric with the remedies and cross-references. And the mental rubrics are very difficult to learn by the dictionary meaning alone. And we have to learn it from the mouth of great teachers and by constant practice. Because many of the rubrics or majority of the rubrics have similar dictionary meaning. But their interpretations are entirely different. The medicines are also different. So this is an attempt to help the beginners and the practitioners in unfolding the finer differentiating feature of the so-called similar rubrics. So the second one, teach a man to fish. You feed him for a lifetime. That means we are going to discuss a methodology rather than giving some tips. So I would like to discuss something about the importance of the miasmatic prescription, how to trace and convert the mental symptoms, and what are the problems in the interpretation of the rubrics, something about the comparative study of the mind rubrics, miasm at various levels, and the criteria or the priority in the selection of the rubrics, and something interesting about the body language. So listen to the sessions very carefully, and we are discussing only the nutshell points. So in nutshell, how to trace the mental symptoms effectively from the patient, and how to convert that mental symptoms for a better prescription. So this is an attempt to help the practitioners and also the newcomers alike. So one of the most important things required in homeopathy, the basic requirement for everything, our case taking should be perfect. If you neglect making a careful case taking, always remember the patient, but in the end, you yourself will suffer from it. That means you will lose a lot of cases. And ultimately, the people may blame homeopathy also. That means, even though you have good knowledge in the materia medica, repertory, organon of medicine, or the practice of medicine, whatever it may be, if our case taking is not perfect, we will never get the decided result. If you have no time to take the case, just give another appointment, rather than giving some remedies. So, always remember this thing throughout our life. Our case taking should be perfect, otherwise we will never get the decided results. And if you are not considering the miasm, and remember these words also, their beginning was promising, the continuation less favorable, and the outcome hopeless. If you are not considering the miasm in the chronic disease, their beginning was promising, the continuation less favorable, and the outcome hopeless. So, as in the case of acute disease, the etiology is very important in the case of acute disease. Similarly, the miasm, that also we have to consider in order to get a good result in a chronic disease. And this is the greatest discovery of Hariman, rather than the principles of similia, because he experimented more than 12 years on miasm. The discovery of the Hariman, that's a miasm, It's considered as his greatest contribution, more than the law of similars. And we will discuss one by one the simplest method of teaching and learning. So, which is the most reliable method in tracing and converting the rubrics? There are a lot of different methods, but the most important one, that is converting their life situations into the language of the materia medica or repertory. So, converting their life situations rather than asking directly or by using a dictionary, the best method is the converting the life situations of the patient into the language of the repertory or materia medica. This is the most reliable method. I will give some common clinical examples that we encounter in our day-to-day practice, just to try to answer for these clinical conditions. First, ovarian cyst or migraine in a lady with a history of torture in husband's house. And her husband, he may be working in abroad, in the States or in the Gulf countries, and by the constant torture by the in-laws and by the mother-in-law, she never disclosed anything to her husband or to her own family. She suppressed everything. And this is a common clinical condition in our day-to-day practice. And ultimately, because of the suppression of the anger and grief, whatever it may be. So this is her life situation. We are converting that life situation into the language of the repertory or the materia medica. So the most important rubric in that case, ailments from indignation. That means complaints from suppressed grief and anger. You got the point. We converted her life situation. She suppressed everything, the torture, another thing, never disclosed that to her husband or to her own family. Ultimately, that results in the development of a migraine or the ovarian cyst or whatever it may be. Now, the second example, that patient fed up with all modalities of treatment. He tried allopathy, Ayurveda, Unani, and even Mantravada, etc., whatever it may be. He tried a lot of modalities, and now he stopped all types of treatment because he never gets any improvement or any cure or any relief for the patient. So, in this case, and he stopped further effort also. Now he is not taking any medicine because of the desperation. So in this case, the rubric is not desperate, but disgust. Mind disgust. D-I-S-G-U-S-T. That means despair of recovery, and he stopped further efforts. He is not taking any other or trying any other methods of treatment. He is so desperate. So the correct rubric in this case is disgust. That means despair after repeated failures, and he stopped further efforts. He appeared for many examinations but failed everything, and nowadays he is not writing any examination. That's the meaning of disgust. That means despair after repeated failures. Despair after repeated failures, and he stopped further efforts. Now the third rubric. The rubrics for the children in old age homes. The rubric is forsaken. Why we are taking the rubric forsaken? That means the children of the orphanage, old age home, they have everything. Good food, good dress, good education, good vocational training, good job, recreation, etc. Still they have an inner feeling that I have my daughter-in-law, nobody is with me. So that means the feeling of being left alone. Feeling of being left alone even though they have everything. So that is why we are taking this forsaken orphanages. So you got the 3 points. Idea about the 3 points? Indignation, disgust, forsaken. Okay? So we'll move further. That means that we are converting the life situation of the patient into the language of the repertory or the materia medica. This is the most reliable thing rather than asking directly about the patient, whether you are angry, whether you are sad, or whether you are depressed, or by using some dictionaries. Now the next clinical condition. Now always remember, the extracting the mental symptom is not a difficult task. We can ask something by extracting directly to the patient or by observation. I will give some good examples. How to extract by observation. Because, one example, a patient is worried about waiting of his turn and repeatedly asking about his number. Suppose we gave the appointment as 4 o'clock. The time is only 4:03 or 4 after 5. The patient is repeatedly asking about his turn and he is moving the chairs and he is coughing and he is always looking into the watch. That means the rubric mind impatience. You have to take that rubric without asking to the patient, simply by observation. Patient is worried about his turn, he is repeatedly asking about his number, he is coughing and he is moving the chairs, etc., etc. So that is impatience, observation. And second example, start narrating the complaint spontaneously. Even without asking what is your problem, the patient will start to explain about his problems. So you have to take the rubric mind extroverted. That's simply by observation. And another rubric, the patient is very neat, clean and carefully combed. The rubric fastidious. Observation. We are not asking anything, but the patient is very neatly combed, ironed and dressed everything perfectly. That means fastidious. You have to take that rubric without asking whether you are fastidious or not. So by observation also we will get rubric. Now some other conditions. And the patient is satisfied, even the various hurdles and problems in the life. He has a lot of problems in the life, but still he is in a laughing mood and he is satisfied and with these available resources, even though he is suffering from some serious diseases. So we have to take that rubric content. That means converting the life situation of the patient. Despite various problems and hurdles, financial problems, diseases, and threats, he is satisfied in his life. So the rubric is content. And the second condition, the patient criticizing harshly the previous doctor. And that doctor collected a lot of money from me. He is not treated perfectly. He is simply collecting money. And the patient criticizing harshly the previous doctor. So in this case, we have to take the rubric abusive. That means they are using harsh, insulting languages as a routine. That is a routine behavior. That is not in this instance only. They use harsh, insulting languages as a routine. So that is the meaning of the abusive. The content meaning, they are satisfied despite various problems or hurdles in their life. Now another one, the third, by observation. The patient is not looking straightly, but with an angular look. In that case, we can take the rubric mind selfish. Now these 3 points, the following 3 rubrics, that is very important because we commonly encounter this problem. Patient is very anxious about the simple diseases. Then the rubric mind anxiety health about. Mind anxiety health about. Should be very careful by comparing the other 2 rubrics also. And the second case, all investigations are normal. Still the patient is very much afraid. All investigations are normal. Still the patient is very much afraid. Then the rubric is mind hypochondriac. Mind hypochondriac. And the third clinical condition similar to that, no feeling on his sufferings. No feeling on his sufferings. That means mind indifference. So always take care of these 3 rubrics. First one, mind anxiety health about. That you have to take in clinical condition. The patient is very much anxious about even a single fever or single diseases also. And in the second case, even though all the investigations are normal, the patient is very much afraid. The rubric mind hypochondriac. And the third rubric, no feeling on his sufferings or diseases. That means mind indifference. I think you got the points. Am I right? Can I move further? Okay, thank you. Then some other conditions. How to convert that the life situation into the language of the rubric or the material medicum. Doctor, I don't care about money, but your medicine is too costly. I don't care about your money. I don't care about my money, but your medicine is too costly. When the patient is explaining like this, you have to take the rubric mind awareness. We will have some differentiating features of the avarice, greedy and miserly later. And immediately after the marriage, the patient wants to separate from the parents to make his own property. That's common nowadays. He wanted to separate from the parents, and especially some immediately after marriage, to make his own property, not caring the parents. So the rubric, mind selfish, mind selfish. And the third condition, he has a great feeling easily, even from cutting at the simple jokes, he seems to be offended. So the rubric, mind offended easily, means hurt easily, even by simple jokes. Mind offended easily. Now, another condition. He always keeping a distance with the social relations. Always keeping a distance with the social relations, not mingling with the neighbors or the neighboring families. Always keeping a distance. In that case, we have to take the rubric mind aloof. Aloof is the rubric. And this type of rubric, this rubric is not available in our Kent's repertory, and we have to use our latest repertories like the complete repertory, the Murphy's repertory, or the synthesis repertory. Some rubrics that may be useful in our day-to-day practice. And the second condition, I never involve in my family matters. Wife always take care of them. I don't take care. Wife always take care of them. I am not looking about my family. I am looking only about my business and other things. But wife is always taking care of it. I have no idea about my family matters. If the patient is saying like this, we have the rubric apathy. Apathy. Apathy is the rubric. And the third condition, I lost my life after my mother's death. Then the rubric is bereavement. I lost my life after my mother's death. This rubric is available in the synthesis and complete repertory, only not in Kent's repertory. So keeping a distance with the social relations, aloof, and apathy towards the family matters, then the rubric apathy, and the patient thinks that I lost my life and nothing else after my mother's death. Then the rubric is bereavement. Now suppose the patient is, the student or the patient is explaining like this. After coming to new school, I am missing my best friend. You can note on this rubric and for the letter, for referring later. After coming to new school, I am missing my best friend. In that case, now this is the rubric is not the grief. The rubric is desolate. Rubric is desolate, not the grief or the forsaken. After coming to new school or new job or to new college, I am missing my best friend. That means desolate. That means the loneliness after someone you love died or left. Then the forsaken. As I said earlier, I feel very lonely. No one is taking care of me. My son or my daughter or my daughter-in-law, nobody is taking care of me. I am alone here. That means forsaken. Feeling of being left alone. That's the meaning of the rubric. About our principal or our boss or somebody at home, we cannot predict about his nature. Then the case, the rubric is abrupt. That means sudden outbursts without any notice. Abrupt means we cannot predict about his nature. So in that case, we have to take the rubric abrupt. In all these cases, we are converting the life situations. We are not directly asking. Okay? Then another important rubric. Feeling on hearing news about the accident, not about his family members. So the rubric, this rubric is available in Kent's repertory also. Mind horrible things, sad stories affect her profoundly. Simply by reading the newspaper or watching the TV about the accidents or about the earthquake that happened anywhere that's away from our country, she has a great feeling of sadness. So in that case, the rubric is mind horrible things, sad stories affects profoundly. And suppose in the case of a student, he will answer to all questions very quickly. That's a good mental power, answering very quickly. In that case, the rubric is agility mental. Agility mental. Some more rubrics, some more clinical conditions. When he gets anger, he uses bad words. As I said earlier, abusive. Bad words. As the routine, the peculiarity of the abusive is, They use harsh, insulting languages as a route. They always use this type of languages only. Then only we can take the rubric mind abusive. When he gets anger, the husband, he use hard, means the harsh words or the bad words. Always using. Then only we can take the rubric abusive. Otherwise, never take the rubric abusive. Then the individual seems to be very difficult to adjust to new situations. The student found it very difficult. And the newly married wife or the daughter-in-law found it very difficult to adjust to the situation. She is interested in getting admission to MBBS, but unfortunately or fortunately, she got admission to BHMS. And she finds it very difficult to adjust in the classroom. Then the rubric, mind, adaptability, loss of. Mind, adaptability, loss of. So that is the rubric. Then another clinical condition. Before marriage, I have sexual relations, still continuing after marriage. Before marriage, I have sexual relations, still continuing after marriage. Then the rubric is adulterous. Adulterous. Mind adulterous. That is the rubric. Even he is continuing this type of relations even after marriage. That means he is not faithful towards her wife, towards his wife. So the rubric is mind adulterous. And now with a pause. And always remember, many of the mental rubrics have the similar dictionary meaning. Their interpretations are entirely different and the medicines are also different. And this is another problem that we are facing. It is very difficult to study the mental rubrics by dictionary meaning alone because their interpretations are different and the medicines are also different. I will give some good, beautiful examples. Okay? For example, the rubric jealousy and envy. The dictionary meaning of both these conditions, jealousy and envy, both are same. But just to refer the repertory, in cancer repertory, mind envy or mind jealousy, the medicines are different. The medicines are different and their clinical condition or the interpretation is also different. So in this case, one is positive and another one is negative. Envy is positive and jealousy is negative. And the medicines are different. I will give you the interpretation of the envy and jealousy. Envy means I am envious towards my neighbor. My neighbor has a good car. He has Audi or Benz, but I have only Maruti. So I am collecting money from different sources and from my clinical practice and from banks, and I also purchase one Audi or Benz car as of my neighbor. That means envy. I am envious towards my neighbor, but trying to attain the prosperity of my neighbor. You got the point. That is envy, trying to attain the prosperity of my neighbor. And the jealousy is exact opposite condition. I have one good car, the Benz or Audi, but my neighbor should not have. And I have a good husband. I am an IT professional with a good salary, but my friend should not have. To attain the prosperity of others, but the jealousy, the prosperity of others, intolerable. So the medicines are different, their interpretations entirely different, but the dictionary meaning is same. So this is one of the problems we are encountering in our clinical practice by using the mind rubrics. I will give some more good examples, so it is very easy to understand how to compare the rubrics along with the remedies. I think you got the idea about the envy and jealousy. Can I continue? Okay. And one thing you would like to remember always, that for getting a good symptoms, good mental symptoms from the patient should feel that the doctor is someone who cares, where he can trust, and to him he can reveal everything. You have to develop an attitude like this. The patient should feel that the doctor is someone who cares. He will care me, and where he can trust, and to him he can reveal everything. So we have to develop an attitude like this. Then only we will get good clinical, good mental symptoms, the personal details, and the sexual complaints. Otherwise, the patient will not disclose their personal problems. So the patient should feel that this doctor, he will care me, where he can trust, and to him he can reveal everything. And now we'll discuss simply about the miasmatic prescription. Everybody is saying that the miasm is important, and but how to prescribe on the basis of the miasm. So first we will discuss the miasm at cellular level. Simple thing, simple to understand. Surah means deficiency, psychosis, excess in cellular function. Everybody knows about this. And syphilis, perversion in cellular function. So we'll discuss about the miasmatic understanding of the mind rubrics. Surah, deficiency in cellular function. Psychosis, excess in cellular function. Syphilis means perversion in cellular function. Always remember these three things. Then it is very easy to identify the miasm of a particular Surah, deficiency, psychosis, excess, syphilis, perversion. You got the point. Okay. Always remember this thing. Then it is very easy to understand the miasmatic aspect of a rubric. Now the miasm at physical level. Miasm at physical level. That means the constipation due to decreased movement of the intestine. Deficiency. That is Surah. Diarrhea due to excessive intestinal movement. That means excess growth. Psychotic. Diarrhea due to excessive intestinal movement. And the third condition, spasmodic or perverted movement of the intestine like this intussusception or the volvulus. That means syphilis. So, comparing the previous slide, one is deficiency, second excess, third one perversion. So, physical level, that means the deficiency, constipation, decrease the movement of the intestine, that is Surah. Diarrhea due to excessive intestinal movement, that is psychotic, and the perverted movement, that is syphilitic. So, miasm at physical level. Then one more level. Miasm in the same organ level. Miasm in the same organ level. Suppose your patient has myocarditis or inflammation of the heart. All inflammation comes and majority of the inflammation, itis, comes under Surah. Itis, that means inflammation, comes under Surah. Then excess, hypertrophy of the heart. That means psychosis. Psychosis. And the third point, infarct or the prolapse of the valve. That means perverted. Infarct or prolapse of the valve, that comes under the syphilitic. So miasm at the cellular level. Then we discussed the miasm at the physical level. And the third one, miasm at the same organ level. Myocarditis, inflammation, that means Surah. Hypertrophy, excess, that means psychosis. Then infarct or the prolapse of the valve, that comes under the level, physical level. And the third one, miasm, the miasm in the same organ level. Now we'll discuss the miasm at the level of the mind. If you have the preliminary idea about the excess, perversion and this deficiency, it is very easy to understand the particular miasm of a particular rubric in the chapter mind. So, Surah at the level of the mind. The peculiarity of the Surah equation. I am explaining the entire thing in one slide, not too much elaboration. Everything in nutshell that will be useful for our day-to-day clinical practice. So, Surah at the level of the mind. The main character of Surah is timid with inhibition. They always need a support to start anything. Timid with inhibition. And they are not aggressive. They are not at all aggressive people. They are God-fearing and religious. They are God-fearing and religious people. And they dress and work as per the norms of the society, not unnatural dress. They dress and work as per the norms of the society. And they deny importance to himself. First, they will support others. They are denying importance to nature of work is also straightforward, not crooked. So, straightforward in their work. And in sex, they have natural sexual relations only. Natural sexual relations. And the last point that is also very important. Even though they have anxiety and sadness or the timidity, the anxiety and sadness that is very easily. They will overcome the anxiety and sadness very easily. And they will do everything, but they have timidity with inhibition. They need some support. If you give some support, they will do everything. And they are not aggressive. They are God-fearing, the true religious people. And they have dress and work as per the norms of the society. They deny importance to himself. First, they support others. And their work is also straightforward. And the sex, natural sexual behavior. And even though they have anxiety and sadness, that will be overcome easily. So this is about the Surah. Now we'll come back about the psychosis and syphilis. A comparative study that is always better for a better clinical prescriptions. So next, psychosis. Psychosis at the level of mind. The main feature of psychotic personalities, that means ostentation. Ostentation means to show off. They will do everything to show to others, to show off, ostentation. But in psychosis, we discussed it as timid with inhibition. But in Surah, but in psychosis, ostentation, everything to show off. And they have rounded face with fat accumulation. And they are selfish and ambitious also. Selfish and ambitious. So in the previous slide, we found it that they deny importance to himself. But in psychosis, they are selfish. But at the same time, they are very ambitious, hardworking people. So you have to note on that particular feature. They are very hardworking and ambitious people. But at the same time, they are selfish. They work very hard, but they never accept the responsibility of failure. That project failed not because of me, because of some other person. And my college deteriorated not because of me, even though I am the principal, that's because of the superintendent. They are very hardworking people, but they never accept the responsibility of failures. In previous slide, we discussed it as the Surah. The work is straightforward, but in this case, that is not straightforward. Even though they are working very hard, they never accept the responsibility for failures. Then the next, God for favors. In the previous slide, we discussed it as they are two religious people, but in this case, psychotic personalities, they visit the temples or the masjids or the mosques or these churches for getting some favor. Usually the politicians visit the different types at the time of election. They will visit, they used to visit these religious places. That's only for getting some votes, for favors. Or at the time of examination only we are going to temple or masjid or church. Otherwise we are not going to temple, masjid or church. So the psychotic personalities, their religious things, their religious affections or the interest in religion, that is only for getting some favors. They are not true religious people. And the sex. In the Surah we discussed it as natural sexual behavior. But in psychosis, they have excessive sexual desire and they have multiple partners also. They have excessive sexual desire and they have multiple partners also. Multiple partners. They are not satisfied with a single lady. And the last point, the fear and sadness expressed on the face. In the previous slide, we discussed it as Surah, anxiety and sadness overcome easily. But in psychosis, it is very difficult for them to overcome the sadness or fear that is expressed on their face for a long time. The fear or sadness. But so, they are very hardworking, ambitious people. At the same time, they have to show off. They are selfish. They have multiple sexual partners. But these psychotic personalities, they are the greatest achievers, very hardworking personalities. Now I think you got idea about the, yes, any doubts? Dr. Sifa Muhammad, it is audio, Sifa, it is audio with the PowerPoint presentation. If you have a good internet connection, you will get these the slides and also this audio plus video. So now we'll discuss about the syphilis. So Surah, psychosis, the next one, syphilis. Syphilis at the level of mind. Yes, they are very aggressive and offensive people. That means the majority of the artists and the film, the actress or the actors, they are coming under this syphilitic personality. And majority of the authors, included this film industry and this painters or this artists, they are come under the syphilitic personality because their creativity is so strange. Unnatural behavior in the screen or unnatural, that's not possible. Extra human power. So the film, the person in the film industry or the painters or this artist, they comes under the syphilitic personality. Creativity, strange. And no dress sense as per the society norms. The Surah, syphilis, they have no dress sense as per the society norms. You can see one dress in our slide also. And the most terrorist, because they comes under the aggressive and offensive personalities. Most terrorists, that is included in the syphilis. And the fourth point, that they are indifferent to what others say and consequences. They are not taking care about others' consequences. That is why they are aggressive people. They are offensive. They are terrorists. They are indifferent to what others say and consequences. And regarding the nature of the sex, in Surah we discussed it as natural. In Psychosis, excessive and multiple partners. But in Syphilis, either celibacy or perversion, perverted sexual habits. So, perverted sexual habits or celibacy. Celibacy means the complete act of sex or entertainment. So, celibacy. So, brief comparison about the Surah, Syphilis and Psychosis. At the cellular level, physical level, same organ level and the mind level. I think you got some idea about the comparative study of the miasm at the level of the Surah, Syphilis and Psychosis. Now we will have some practical examples from the cancer repertory and also from the synthesis repertory. Then it is very easy to understand. So always keep in mind these 3 points, these 3 slides. Surah at the level of mind, Psychosis at the level of the mind, and the Syphilis at the level of the mind. A lazy man has no place in homeopathy. Read daily a drug and 2 on Sundays. This is one of the famous quotings by the M.L. Taylor in his book, Homeopathic Drug Picture. But personally, we are not reading daily and not at all on Sundays. But a lazy man has no place in homeopathy. Read daily, a drug 2 on Sundays if possible. Now, facing the mind, we have to encounter the life situations in detail. We already discussed a lot of points, how to convert the life situations into the language of the repertory. Encounter the life situation in detail. But always remember, we have to confirm the mentals from the friends and relatives. Hanuman explained in the organon of medicine it as, you have to observe the expression on the face of the people accompanying the patient while the patient narrating the symptoms. You have to observe the expression on the face of the people accompanying the patient while the patient narrating the symptoms. Because the patient they will always tell about the positive matter. The majority of the patient never tell about their negative sides. We also tell our positive side only. So we have to confirm, suppose a patient explains like this, I am so courageous. Just look at on the face of the wife. The wife might have some in a laughing mood. So you have to observe the expression on the face of the people accompanying the patient while the patient narrating the symptoms. And always confirm the mental symptoms from the bystanders or from friends and relatives. Otherwise the patient may mislead you. They will tell always the positive things. Majority of the time they will never disclose the negative things. So in the first trimester, that will affect the child also. That is why in our literature we always say that the pregnant lady should be in a good mood, they're always healthy and always in a laughing mood. If the mother is depressed, the child also becomes depressed. So in that case we have to take the rubric for the child. Suppose the child might have some problems, the depression or the fear. Then we have to take the history. From the history we will get that at the time of the pregnancy, the mother undergone some fear or some depression or some anxiety, etc. Then we have to take the rubric, mind ailments from fright or mind ailments from grief, something like that. So we have to inquire about the state of mother during pregnancy, especially at the time of the first trimester, the first 3 months. That will definitely affect the child. And the reactions in the life situations. You have to ask about the reactions in the life situations. That means if something happened unexpectedly in their life or in their career or in their education, how they managed it. So that's the reactions in life situations. Then the occupation and area of work, that is also very important. I will give you some good examples. Occupation and area of work. Suppose a patient constantly changing his profession. He worked as a homeopathy doctor, then as a sales representative, then some other work, or the medical transcriptionist, something like that. He always changing his occupation. So in that case, which rubric will work out? Anybody can comment in the chat box. Always changing his occupations or always changing his decisions. Never stick on to one occupation. Anybody have a comment in the chat box? No, cosmopolitan means a desire to travel. Cosmopolitan, that means desire to travel. So the exact rubric is, yeah, somebody is, chatted it as irresolute, wavering mind, dissatisfied. Yeah, that's somewhat similar rubric, no problem. The exact rubric is inconstancy. That means they are not sticking into one decision, they are not sticking into one profession, always changing their occupation. Then Dr. Mahida, they cited it as irresolute. What is the exact meaning of irresolute? That is also something related to occupation and area of work. Irresolute. Irresolute means unable to decide upon. Suppose a lady entered into a textile shop. Almost all the churidars or dupattas means the salesman put out of his cabin, but she is not satisfied. Which shoe or which dress I to select, or which profession I to select, or which husband I to select, whether an IT professional or a homeopath or an MBBS doctor or whatever it may be, at the time of this marriage proposal. That means irresolute means unable to decide upon. Unable to decide upon. So inconstancy means they are not keeping in one decision, or they are always changing their occupation. Irresolution means unable to decide upon, unable to decide, or unable to select a shoe, or unable to take a decision. Now the Dr. Neeraj Gupta has commented as a discontent. Discontent is the same as Alfia Feroz, dissatisfied. Means they are always dissatisfied. A newly married couple, and the lady, she came to the husband's house, but she found it very difficult to adjust with the parents of the mother-in-law or the father-in-law. So always dissatisfied. So the occupation and the area of work, that is also very important. So inconstancy, we discussed 3 rubrics: inconstancy, irresolution, then discontent, always dissatisfied. So 3 rubrics. So what's your doubt, Dr. Neeraj Gupta? The rubric is inconstancy, always changing occupation. No, the question by the Dr. Shivam: if someone often changes the place of furniture of his room, then I can then whether we can take the same rubric, irresolute or inconstancy. Irresolute means unable to decide. Inconstancy, always changing. That's the main difference between irresolute and inconstancy. And the third rubric that may be useful in that case is, that means the rest cannot, there is a rubric in the chapter Mind Rest, even in Kent's repertory. Rest cannot when things are not in the proper place. That is also, we can think about Dr. Shivam. And Dr. Pratik Kumar De, he mentioned it as, why not desire for change in life, sir? Change in life, that means this is a broad rubric. Inconstancy, that covers all these things. The change in the life. Change in the life means they are not frequently changing. They are changing at least one profession to another profession. But if the patient is changing his occupation constantly, then only Dr. Pratik, we can take the rubric as inconstancy. Otherwise, if you shift only one job or 2 jobs, not like that, the rubric is not inconstancy. You are correct. So the occupation and area of work, and the idea in relationship. We have 3 relationships: individual relationship, family relationship, and the social relationship. How the patient behave in an individual relationship, the relationship with his friend or his wife, then the family relationship with the in-laws or the father, mother, or the grandparents, etc. And the third point, the social relationship. We have to ask about these three things. Idea in relationship, and ask the questions in opposite direction. And this is also an important thing. Suppose if a patient, you think that if the patient is sad, then you are asking about, are you sad? Then most probably he will answer it like that, no, I am not sad, I am not sad, I have no problem. So ask the questions in opposite direction, ask him to explain some beautiful moments in his life, then he will explain the negative things or the grief or the desperate things happened in his life. So always keep in mind, anger the life situation in detail, and converting the life situation into the language of the repertory, that's the most reliable thing. And you have to confirm the mentals from friends and relatives. Never take the patient says at the face value. You always confirm it. And the state of mother during pregnancy, and the reactions in the life situations, how they behaved in a critical situation, and their occupation and area of work. We can easily convert their occupation or the area of work into the language of the repertory, and the idea in relationship. And always remember, and in extreme cases, ask the questions in opposite direction. And my humble request, take Mendel's only when they are relevant. Otherwise, you can prescribe on the physical journals or particular relevance. But if the patient has a particular or some relevant Mendel symptoms, if you are not taking that, that case may ultimately leads to failure. Always remember, if the patient has some typical Mendel symptoms, and if you are not considering it, we will never get the desired result. Always remember about that. But take the Mendels only when they are relevant. And to be acceptable, the mind symptom must be peculiar to the patient. And the third point is also very important. The patient expresses Mendel symptoms with the spontaneity, clarity, and intensities of highest value, without asking directly or without too much questioning. If the patient explains about something, some Mendel symptoms or physical journal, whatever it may be, with spontaneity, with the clarity and intensity is of highest value. So the question, after so much of questioning, the patient discloses something, so that is not a good Mendel symptoms, but the patient expressed with the spontaneity, clarity, and intensity is of highest value. Now we will discuss, compare these three interesting rubrics. Three consecutive rubrics is Kemp's repertory, synthesis and Murphy's repertory, complete repertory also. And this is very interesting. And we will have a comparative study of the miasm also. So if you have a text, you can refer this. The rubric, contradiction disposition to, contradiction intolerant of, and contrary. Three consecutive rubrics. Just refer the textbook. The medicines are somewhat different. Their dictionary meaning is more or less same, but the interpretation is entirely different. So watch these three slides very carefully. Then we'll get a good idea about the comparative study of the mind rubrics. So what is the meaning of the contradiction disposition? Do we listen to this slide very carefully? Because the similar dictionary meaning, entirely different medicine, interpretation entirely different. So contradiction disposition to. So that means he will oppose anything and everything in a meeting, but by applying the intellect with the argument. With argument, intellect. He is using intellect to contradict to the president or to the secretary in a particular meeting, or contradicting the principle, but by applying the intellect with the argument, with the proper argument. So that's a feature of the contradiction disposition too. Now the next meaning, the rubric, that's a contradiction intolerant of. That means he dislikes contradiction. He will leave from the meeting. The first person opposes everything and anything, but by argument, applying the intellect. And the second one, contradiction intolerant of. That means he dislikes contradiction. He just leave from the meeting. And the third rubric, that is contrary. So this is an exact opposite condition of the first rubric, contradiction disposition to. Contrary means he will oppose anything and everything, but without applying the intellect or without any proper argument. He wants to dissolve that particular meeting. So he will shout and make contradictory arguments without any proper intellect or without any proper argument. So contrary means he will oppose anything and everything without applying the intellect or argument. So this is the difference between three rubrics. And can you spot the miasm of the three rubrics, since you already studied about the miasmatic aspect of the rubric? Anyone please? Contradiction disposition to, he will oppose anything and everything, but by applying the intellect with argument. And the contradiction intolerant of, he dislikes contradiction. And contrary, it's a destructive symptom. He will oppose anything and everything. Can anybody suggest the miasm of the contradiction disposition to? They are very hard-working achievers. They are shouting, but they never accept the failures. Either the contradiction disposition to. Yes, very good. Psychosis. Contradiction disposition to the miasm is psychosis. Very good, very good. I am very satisfied because you got the idea about the miasmatic understanding of the rubrics. Then it is very easy to forward with the remaining slides. Very good, very good. Contradiction disposition to. It's a personality, psychotic personality. He will shout by raising the voice, but by using the proper intellect. And the contradiction intolerant of Surah. Contradiction intolerant of means Surah. He dislikes contradiction. He is very sensitive. Then contrary. What is the miasm of the contrary? A destructive symptom, opposing anything and everything. Yes, very good. Many of the participants supporting this as syphilis. Syphilis is the miasm. So for a syphilitic patient, we have to take the rubric contrary. And if a patient expressing this type of symptom, we can identify the miasm of that patient as, thank you for your active participation. I am also satisfied because you got some idea about what we already discussed. Then it is very easy to move forward. Thank you for your support. Now we will discuss some rubrics for the children in our day-to-day practice. Obstinacy. The mother always explains that the child is so obstinacy. So there are some different rubrics are there for children. So one rubric is obstinacy. And the second one is disobedience. Mind disobedience children. That's a rubric. And remember, all these rubrics are not available in Kent's repertory. Some rubrics are available in synthesis repertory and some in Murphy's repertory and complete repertory also. Mind obstinacy children. Then disobedience. That is another problem in children. Then destructiveness in children. He will destroy all the toys immediately after purchase or within one day. Or destruct everything, destructive tendency, everything in our home. So mind, difference between obstinacy and stubborn. Stubborn is Dr. Nehal Surta. She has one doubt. What is the difference between obstinacy and stubborn? Obstinacy is they are very hard on their decision. Stubborn is very hard on their decision. But obstinacy is comparatively mild form. So you can ask any questions in between the session. I am interested in more than a one-sided lecture. I would like to have an interactive session. Thank you for the question, Dr. Nehal. So destructiveness in children, then sleeplessness in children. Always remember the sleeplessness in the remedy for the sleeplessness of children and adults both are entirely different. Now just go through the rubric sleeplessness children in synthesis repertory or in Murphy's repertory or in complete repertory. You will get lot of beautiful sub-rubrics. You will get lot of beautiful sub-rubrics for the different conditions in which the child gets sleepless. And always remember the sub-rubrics are more important. If you go through the sub-rubrics of the sleeplessness, you will get the conditions, you will get in which are the conditions the patient gets, the individual gets sleeplessness, the woman gets sleeplessness or the children get sleeplessness. If you go through the sub-rubrics of the anxiety, you will get the reason for the anxiety. So always give importance to sub-rubrics. Then our case taking will become more perfect. Now one more question, the difference between obstinacy and fixed idea. Fixed idea is somewhat different. Usually we are giving this remedies like Tuja, means it is very difficult to change their ideas. And that is entirely different from the obstinacy. If the patient gets that particular toy, his obstinacy will be over. But the fixed idea, that's very difficult. And we have some rubrics related to the fixed idea in our coming slides that we will discuss in detail. Thank you, Dr. Shivam, for the question. Then another rubric, restlessness in children. Restlessness in children. Mind, restlessness, children. And this is one rubric for the ADHD also. And in ADHD, that's very common. And which is the most important rubric for the attention deficit hyperactive disorder? Can anybody explain? Because this type of ADHD cases are very common nowadays. The most important symptom for the ADHD, attention deficit hyperactive disorder. Which rubric we will work out? If anybody knows, just have a chat. Otherwise, I will discuss because that rubric is required in our day-to-day practice. Nowadays, we are getting lot of cases of the ADHD. There's activity, then hyperactivity. Dr. Rana, I will discuss this question immediately after this ADHD. Inconstancy, activity disease, restlessness. There are some good rubrics. But please note down these two important rubrics for the ADHD. The first rubric that is available in synthesis repertories, that's in the chapter generalities, energy, excess of energy in children. General energy, excess of energy. That's a rubric in synthesis repertory. And in Murphy's repertory will get the direct rubric mind hyperactive. Children chapter hyperactive. But the most reliable rubric is generalities, energy, excess of energy. I mean they are always physically restless. And the second rubric, please note it down if anybody requires, that is the mind concentration difficult. That is there in synthesis repertoire and in other repertories also. Mind concentration difficult, attempting to concentrate on. The ADHD, the children, they are very difficult to concentrate on anything for a short time. Immediately their attention will change. That is a attention rubric, attention deficit, hyperactive disorder. Hyperactivity that covers under the generalities, energy, excess of energy in children, and the mind, mental restlessness, that or the concentration difficult, attention difficult, that comes under the rubric mind concentration difficult, attempting to concentrate on. These are the two important rubrics in addition to the other conditions of the patient, and it is always better to take these symptoms rather than the diagnostic rubrics. So one question previously I got, that is by Dr. Rana. What is the rubric when the patient doesn't make eye contact with the doctor, always looking downwards or somewhere else? In that case, we can take the rubric directly. And one good question by Dr. Goyal. We take such rubrics which are common to disease or conditions. It is better to take the rubrics, I mean the symptoms of the patient, rather than giving importance to the diagnostic rubrics, Dr. Goyal. And if the symptoms are not available, we can take the direct rubrics. That's not a problem. So can everybody hear me perfectly? Okay. So we'll proceed. Children, he's always dull, he's not interested in study and not coping with his colleagues. So mind, dullness, children. For eye contact, that means the patient is because of timidity or shamefulness, the patient is not listening. Dr. Sheetal, the rubric, timidity, mind, timidity. That's the rubric. Okay. Now one interesting thing that I would like to announce now, the Dr. Jawar Shah is also joining with us, and he'll give an introduction for something. He would like to talk to you also. So Dr. Jawar Shah, sir, welcome to this webinar. He's arranged everything. So we are continuing with this slide. That's the dullness, then weeping children in, then indolence. That means the laziness in children. Mind, indolence, children in. That's the rubric, because the child is lazy. Laziness in children, mind, indolence. That means laziness. Then as I said earlier, another rubric is concentration difficult. Children in. There's a sub-rubric, mind concentration difficult, children in. Then the memory weakness, children in. There is another rubric in synthesis repertory, mind, memory, weakness. Their medicines for the adult and children both are entirely different. Memory weakness, children in. Then another rubric, mind, anger, children in. That's also another rubric. So there are a lot of rubrics that is specific for the children, that is available in the mind chapter or the children chapter in Mercy's repertory. I think Dr. Jawar Shah is joining with us shortly.
Dr. Mansoor, good morning.
Hello, welcome. Good morning, sir.
I've been watching your webinar since last 1.5 hours. And I was very patiently listening how you have beautifully analyzed the rubric. I've been really enjoying every bit of it.
Thank you, sir.
You know, you have put in a lot of pain to understand what is mind, because mind has been the most difficult thing which can be interpreted differently. Friends, are you enjoying? Dweep, Babita, Neeraj, Dr. Mansoor, these are all our absolutely trusted ambassadors. You know, they are there for every webinar.
Very good, very good.
Yeah, see, you see immediately there is a major shift. So we would like to have many more such webinars which are practical.
Yeah, definitely, sir. I will try.
From day one.
And they ask a lot of questions also. I am very satisfied.
I would appreciate that there are two things which we are doing. You know, we are going to have a very interesting another presentation from Dr. Mansoor. Those of you are appearing for postgraduate entrance test. So he is going to share all his experience on 10th of June. Plus we have 2 more webinars on herpes. Very interesting webinars. You can register. And also we have Jeremy Share coming up on 21st of June. So every week we have something very interesting. I really appreciate your comments and your suggestions. Please give your suggestions. We want to make every webinar a better one. Imagine the entire team is working for a whole month to make one webinar possible. Like my team has been working for last 6 months only on a particular part of the team has been working only on herpes, because we are going to share on herpes genitalia, herpes labialis and herpes zoster, the single. So please, refer to your friends. Hi Trudy, how are you? So please refer them to your friends, because effort for one person or 1,000% is same. And the responses have been amazing. We have 600 plus people registered for Dr. Mansoor. Even for Jeremy, we have already more than 300 plus registered. So the movement has been very good. Every time we want to increase the number. Dr. Shuyam, we will definitely take remedies, the small remedies. We have a specialist, Dr. Prabhakar Shetty, who specializes in small remedies, and he has been practicing for last 40 years. He has been my friend and my college mate. So we will share definitely on very, very small and interesting remedies, an absolute practical tip which you can apply to the practice from day one. Dr. Mansoor, can we give a break, please?
If a need, we can have, sir. Otherwise, I have no problem. We are usually taking classes with postgraduate students for hours, no problem. But that's up to you, sir.
Okay, so we take a little break and you can come back in another 5-7 minutes. Thank you. I want to thank all of you. I'm going to be here.